Hey, Heidi here with Revive Wellness and Aesthetics. And today I wanted to talk a little bit about probiotics because there's a lot of misinformation and even like complete misunderstanding about what probiotics are and how they benefit or even maybe inhibit health. A lot of information in the area of probiotics comes from companies marketing a probiotic supplement or the blogosphere, and sometimes science is drowned out by these voices. And I have to admit that I have been a victim to many of these claims and have completely misunderstood probiotics in the past. However, researchers are not confused, and I doubt they ever have been. But the experts studying probiotics do know what they're talking about. So I just kind of want to help set the record straight because you often hear, oh, we need to take a probiotic. Probiotics are good for our health. Well, that is such a general statement. That's like saying take a medication for high blood pressure. Well, what medication? Are you going to take blood pressure medication for high blood sugar or diabetes? Probably not. And it's the same with probiotics. They are very specific with what they treat. And we know enough about them now. We need to know what strains treat certain conditions. So to start off, probiotics, the actual definition of probiotics is that they are live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. And in some countries, companies are not allowed to even call their supplements a probiotic unless clinical trials have been done on their supplement, not just that strain, and then they make those claims about their supplement, but actually do research on their supplement. And that is not the case here in the US. And there are hundreds, if not thousands, of probiotics on the market. So how do you know which one to take or which one's going to help you? So typically probiotics, they come in powders, capsules, lozenges, drinks, medicinal yogurts, things like that. But when you're looking for a probiotic, you're going to find genus and species commonly used in supplements or medicinal foods. So like Lactobacillus acidophilus is a popular one you've probably heard of. Lactobacillus rhamnosus, Bifidobacterium animalis, or Bifidobacterium bifidum. These are just a couple of examples of common genus and species used in probiotic supplements and foods. Just so you know, yogurt and even like sauerkraut and your fermented foods are not probiotic foods, and they are often mistakenly called probiotic foods. But again, going back to that definition, when administered in adequate amounts, and it has to be a certain amount for it to be considered a probiotic. I'm not saying those foods are not good, or they do contain live bacteria and live cultures, but every batch is going to be different. So they actually can't be called a probiotic, or they can't be considered as to treat certain conditions. So the characteristics of probiotic treatment are not this genus or species specific that we see. Like Lactobacillus acidophilus is very general. They are strain specific. So if you want to treat like gut problems or help with anxiety or an infection or post antibiotic use, you want to know what strain to look for. For example, a common strain is the LA5 strain of the genus Lactobacillus and the species Acidophilus. So on a supplement, it's going to be listed as Lactobacillus acidophilus LA5. That's what you're looking for, is the LA5. In clinical research, this strain has been shown to treat like gestational diabetes. It helps manage metabolic syndrome, so it's very specific. And it actually can be found in a yogurt called Nancy's Medicinal Yogurt and some other supplements. But if a strain is not listed, be very wary of using that probiotic supplement. Either the company does not know much about probiotics, or they're using a poor source to make their supplements. And also be aware that many doctors and supplement companies call a microbial species a strain, and what they're actually referring to is the species. Like it'll list, we have 10 different species in this supplement, and then they only list the genus and the species or strain. I said that wrong. They will say there's 10 strains, and what they actually list is just the genus and the species, and no strain is listed. So they are very confused even about the difference between a species and a strain. Species can differ in physical characteristics, like how they adhere and whether they are resistant to, bile and acid salts. So if they're going to get past the stomach. So that's species, but the action, the quality, and the efficacy of a probiotic are strain specific. So, and then research on one strain cannot be transferred to another, even if they're in the same species. So Lactobacillus acidophilus, LA5 is going to be very different than a different strain of Lactobacillus acidophilus. So the most important aspect in taking a probiotic is making sure that you're getting the right strain for the task that you are trying to treat or trying to help with. And then adequate dosage, the right amount of that strain, is also very important when you're looking for a therapeutic effect. I think we need to just stop throwing large doses of general probiotics of unknown action and characteristics at health issues, hoping that they're going to work. Don't waste your money. Make sure you know which strain is going to help you individually.